We're now joined by someone who is on the front lines of all of this. We have on the phone Dr. Jennifer Haythe. She's a critical care cardiologist at Columbia University Center in New York City. We know it's a busy time. Dr. Haythe, thank you for calling in. Let's dig right in. Can you give us an idea of what you're seeing day to day in the intensive care unit there?
Hi, thank you so much for having me. So the intensive care unit is definitely pretty intense. We're seeing the sickest of the sick people with COVID, people who have what we call acute respiratory distress syndrome, pneumonia, and pretty much the entire ICU is COVID at this point.
I want to get your take on, we're seeing the fact that their data is showing that African Americans seem to be disproportionately impacted by this disease. And this morning, Dr. Burks talked with Savannah, and she said, she doesn't think African Americans are necessarily more susceptible to infection, but she thinks it's the pre-existing conditions that are causing the problems. Can you weigh in on this?
Yeah, so I work in a community that's predominantly minority as well, and we are seeing a large number of, minority patients. Unfortunately, I would probably agree with Dr. Burks. I mean, we don't have enough information yet to know who is more susceptible and who isn't, other than age and prior risk factors. But we know that the African-American communities and other minority communities that suffer from, poverty, lack of access to good medical care, have more pre-existing conditions like hypertension, diabetes, obesity, and those diseases certainly predispose to more severe infection with coronavirus, which, of course, then has a higher risk of death.
And it's interesting because there are also reports that men seem to be dying at a higher rate than women. I'm sure, is it too soon to see research on that as well?
Yeah, so, again, everybody is scrambling quickly to do as much research on this as they can. And we have seen, a large number of men as well. In order to confirm that that's true, we definitely need the data. So luckily we have, incredible doctors, scientists who have, gotten to work very quickly and are, putting together these studies fast so that we can have more information.
Dr. Haythe, how is it that this disease can impact people so differently? Is it the fact that there are different strains to this? You have some people, as you know, who end up in intensive care, and others who just spend, about a week at home and they're okay. Can you speak to that at all?
I mean, I think it's a great question. We're asking ourselves the same thing every day. Why is it that one person in their 40s who's a marathon runner can become critically ill and a 75-year-old, nursing home patient can recover? We don't have enough information. There's certainly different theories. Is it a strain? Is it how much viral load that you are initially exposed to? Our doctors who had exposure to intubation and ventilating patients at higher risk because they had more aerosolization. Is it something to do with your own innate immune system that we don't understand? So this is all being explored. Every patient that comes in gets a huge slew of labs drawn regularly, what we call the COVID lab set. And we're checking different inflammatory markers, different interleukins and cytokines to see, are some people more susceptible because they make more of these cytokines? We just don't understand enough. It's just too soon.
I only have a few seconds left, but on a personal note, here's the thing. Doctors are people, too. I know you have 2 children. You've made a difficult decision to stay away from them for a while. What do you want people at home to know?
I've seen in New York City people going outside and running and trying to take advantage of the warm weather. And I agree, it's beautiful out now. It's starting to change. But for the sake of all the people on the front lines, it's so important to stay home. We are making big sacrifices and people are risking their lives, not just doctors and nurses, but garbage men and respiratory therapists and nurses. And there are so many people involved in delivering this kind of health care and supporting our communities, even delivery people, so for their sake, just stay home and try to, keep the spread low.
Perfectly said. Dr. Jennifer Haythe, thank you for your time this morning. We wish you all the best.
Thanks for having me. Take care.